You keep suffering from heartburn? Then you should know this one exercise. It works in just 3 minutes and can usually provide you with immediate relief. So go ahead and try it yourself and feel how your heartburn can be quickly calmed down. Where does heartburn come from? We've made a fascinating discovery. It's related to the closure mechanism where the esophagus meets the stomach, which in a way separates the stomach acid from the esophagus. And this closure mechanism is located right at the level of the diaphragm, the breathing muscle. The breathing muscle is too tense in most people as they breathe shallowly, improperly, and so on. And we've observed that as soon as this breathing muscle is relaxed and stretched, and it can be stretched like any other muscle, this effect immediately occurs, where the heartburn is reduced or even completely disappears. So we definitely suggest doing this exercise first before taking any acid blockers. Because often it's assumed that stomach acid is too excessive and that's why it rises into the esophagus. But we can't agree with that view, as we've repeatedly observed that when the diaphragm is properly aligned, the heartburn decreases and eventually disappears completely. Now I'll show you 2 effective exercises. One you do yourself, the other involves pressing, which I'll guide you through. The exercise simply consists of exhaling as intensely and fully as possible. Why does this help? Because exhaling stretches the diaphragm, whereas inhaling leads to its shortening. Exhaling is stretching, that's why we're now taking deep breaths. Through the nose, and now you're blowing out. Slowly, more and more, you're exhaling. More and more, more and more. And then you notice it's getting exhausting more and more. Breathe out as much as you can, as much as you can, as much as you can, and breathe normally again. Okay, you notice that exhaling at a certain point becomes very, very difficult. You continue to push more exhalation into the body with a deliberate and conscious effort to stretch the diaphragm a bit further, aiming to make it even more relaxed, fully at ease, and completely released. Let's do it again. And gently exhale again as if you were blowing out a candle. And breathe normally again. If you start to notice that your circulation feels a bit off or strange, then stop for a moment and take a little break. Otherwise, take a deep breath one more time. Breathe normally once again, take a brief moment to rest. And now we'll repeat the same exercise, but this time we'll combine it with strengthening and include an additional stretch. Because you can also strengthen the diaphragm, it happens in sequence. First imagine it, I'll explain it briefly. You blow everything out, all the air that can possibly escape. And in that very moment, you pinch your nose shut and keep your mouth firmly closed. And you try to inhale against the pinched nose. And then the diaphragm tightens as it stretches and fully engages its strength. And that's the valuable muscle training that I always emphasize in all the other exercises as well. And then we tense it for a moment and then let it go again. We'll repeat that 2 more times. So take a deep breath. And exhale fully. Now try to breathe in against the nose that's being held shut. And breathe normally again. Did you notice how challenging that was? Now we'll repeat the same process, and after that wave-like effort to inhale, we'll take a moment to exhale just a bit more deeply and fully. And if you're able to exhale even further, then that's clear evidence that the diaphragm has stretched a bit more, because that's precisely what allowed you to exhale just a bit more deeply. So, breathe in again. and blow out. Try to take a deep breath in. And breathe out again. And that little bit of air you managed to exhale just now, that was precisely the extra space created by the increased stretch. And one more time, breathe in deeply. And then blow it out completely. Try to take a breath in. And exhale a bit more deeply. That was the proof that the diaphragm was stretched a little further. Now we're going to try something really special. 2 key points allow you to use pressure therapy, a simple self-help technique to relax and release tension in the diaphragm. Lean back in your chair and take a moment to gently feel the 2 rib arches that curve upwards right below your chest region. And just before they meet, you'll notice your xiphoid process. Sometimes you can't feel it because it's pulled inward due to excessive tension in the diaphragm. But right where the 2 lines meet, at that angle, you'll also notice, oh, that specific area is really quite sensitive and tender. And don't press both sides at the same time. Begin with one side, carefully feel that precise angle, and apply some pressure there. Right now, I've used my middle finger. Press there slightly inward against the bone. Continue to breathe calmly and deeply. And press there as firmly as you can just still tolerate it, as firmly as you can just still endure it without causing yourself too much discomfort. Breathe nice and calmly. And then you'll notice that this sensitivity to pressure, where you first thought, oh, I'd rather not touch there at all, it begins to subside. And when it subsides, you can press a bit firmer, because that now indicates to us that the tension in the diaphragm, which is actually the primary cause of this ongoing heartburn, is gradually starting to ease. That the tension is already starting to normalize. And then we'll do the same on the other side. Again, check where that angle is. Search with your finger. If you notice that using your finger is too exhausting, then carve a cork from a wine bottle about like this. It's like the tip from our pressure set. Yes, that osteopressure tools set we have. I'll show you how that would work. But you can also continue with your finger if you don't have it right now. You place it right there. Oh, what a wonderful sense of relaxation. And now, without any force in your fingers, you can very calmly and gently administer the precise dosage that this spot needs to fully release and relax. With gentle, subtle motions, you can still apply a bit of pressure to stimulate and activate more of those pain-sensitive receptors within the pressure column. Keep breathing through. Deep breath in. Deep breath out. And slowly come back out. Do you frequently find yourself dealing with heartburn or reflux? Then give this simple exercise a try. It can quickly ease or even completely eliminate it by adjusting your posture in just minutes. So join in and feel for yourself how your heartburn can calm down. Be sure to share this with people who also suffer from heartburn. They'll truly thank you for it.